I want to talk to you about health. Now, the NHIS subscribers can attend hospital with their Ghana card starting this month. Vice President Dr. Mahmoud Bawumia is expected to announce details of this integration on Monday when he launches the NHIS week under the theme, Leaving No One Behind. NHIA Chief Executive Dr. Lydia Jani Selby announced this to JoyNews in an interview with my colleague, Daniel Akako.
And we find ourselves here in the office of the CEO of the NHIA, the National Health Insurance Authority, in the person of Dr. Lydia Jani Selby. Now, the NHIA week comes up next week. There's a whole lot to talk about, but without further ado, the person who's going to be doing a lot more of the talking is here with us. Thank you for hosting us, Dr. Jani Selby.
Thank you very much for coming.
It's a pleasure to be here. Now, in a year that has been hobbled by COVID-19, this pandemic, how exactly has the NHIA fared financially and otherwise?
Well, luckily we had instituted the mobile renewal in December 2018 for our members. So because of that, our members stayed renewed and able to handle their own issues through mobile phones.
Right.
So that helped us a lot. However, utilization at the hospitals and clinics dropped.
Right.
In April, looking at our data, about 30 to 35% of people who would normally go to seek care didn't go. It is now just about coming back to pre-COVID times, but really it's been down about 30 to 15% running throughout from April to now.
How has that impacted your work?
Well, for us, it's we just receive claims and pay it.
Yeah.
But obviously, it's something we need to think about, that those who may have hypertension, diabetes, and other things didn't go to the hospital. Maybe for fear of catching COVID or whatever. And it's possible they're storing up problems at home, which may come out later. So it's a matter of concern. We're analyzing the claims that are coming in to see if we can pinpoint which category of people didn't go.
Right.
People with acute illnesses will always seek care or emergencies. It's kind of the chronic diseases that people may choose to try and manage themselves at home, and that isn't the best.
And speaking of those acute illnesses, I know in other parts of the world, some of them, with kidney disease and the rest, couldn't get the needed treatment, and that had an impact too. This could mean that some of those who did not get that contact with their doctors and the rest, maybe now there could be further impact on the system when it comes to health insurance, but hopefully the shocks will not be too heavy.
We hope it won't be too heavy.
Right.
But our health system has not been overwhelmed by the COVID.
Right.
So the ability to care for them was there. I think people just chose not to.
Right.
So it's about education to get people to understand that the health system is working.
Right.
And they shouldn't try to manage themselves at home, but should seek care.
I'll come back later on that bit about education, but let's come to the week proper, NHIS week. Tell us, from when to when is it, and whom should we be expecting to be there?
Well, NHIS week starts on Monday the 9th.
Right.
For a week. Now, the theme of this year is leaving no one behind. When you have a health insurance scheme, you have three parties to the scheme.
Right.
The payer, which is NHIA, the purchaser. The provider, which are the Ghana Health Service, the Christians, mission hospitals, the private providers. The third leg is the members, the public, Ghanaians. Now, a lot of the time, the providers and ourselves, we have a lot of stakeholder meetings, a lot of discussions, a lot of collaborations. How often are the public, the third leg of that stool, seriously involved in some of the discussions? Now, we all know if you have a three-legged stool and one leg is short, it's not stable.
Right.
So we decided for this year, this is the first time we've properly had an NHIS week. We usually just celebrate a day or something,
Right.
but we want to have a whole week and institute it so that going forward, this week we concentrate on the members, the public, Ghanaian residents. This is a chance for us to get in with them, educate them on the benefits of the health insurance, encourage people to renew their registration, and generally interact and really make sure we're meeting the needs of the people of Ghana. So that is the main theme of this week. I would like to say we have 23.1 million unique biometrics in our database. That makes us the biggest database in Ghana, people database. And that is 77% of the estimated population, I should say. We need to reach out to all of them to get back on board, stay active. Let's make sure we are in contact with you.
That is actually post-COVID.
Yes.
Right.
Yes, we now have 23.1 million people in our database. So we need to interact and make sure we are meeting the needs of all these people and get them back.
You talk about not leaving anybody behind, but we know that there are people with kidney disease, cancers, and the rest who may not necessarily be beneficiaries when it comes to the scheme. And only yesterday on JoyNews, there was the pathetic situation of a woman whose kidneys are failing her, and she needs some money, and the difficulty in all of that. Are there any plans moving forward, especially as you don't want to leave anybody behind, for such people to be covered?
Right. We need to understand that there are just about no health insurance schemes that cover everything globally. So it's about what we can cover for the greater mass of the people.
Right.
That's why the emphasis is on the primary health care. And most of the, I wouldn't call it basic, but the everyday illnesses. We have built an actuarial model and we are putting the costings in for so many other things to see at what point we can afford to add those.
Right.
We have breast and cervical cancer. We are doing the actuarial analysis for prostate and childhood cancers to see what we can afford and when we can add it. Family planning, it's a done deal because we can see we can afford it.
Right.
So we do listen to the growing needs, the growing health needs of the public, and now we will input it in and therefore be able to advise the ministry. It's the ministry that sets the policy as to what we can add and when we can add it and who we can add it for.
So far, per whatever research you may have conducted, what are you looking at in terms of timelines? I appreciate that you may not be able to tell me fixedly that we're going to do it next year or something of the sort, but what are the projections? Are you looking at the next 4 years, 5 years to be able to say, this is our plan, and we hope by then to open these?
For something like chronic kidney disease, we need data to be able to input into the actuarial model. We don't really have a good handle on how many people need the care. We have to redo the costings, the diagnosis, and all of that.
But these are the same people going to our major hospitals for dialysis and the rest. So how come we don't have the data?
No. You'll be surprised. There are no registers. So it's a matter of liaising with the experts who deal with this and try to get a handle on the estimated numbers.
Right.
But that is why we need to concentrate on hypertension and diabetes. They are precursors to this. They are not the only reasons, but they are the precursors to this. And if we nip those things in the bud, we will not have as many.
Right.
Hypertension and diabetes are covered under health insurance. So but they don't have symptoms and signs until they're far advanced. That is why everybody must be active and have regular checks with their medical caregivers so that you pick it up before the symptoms and signs. Otherwise, by then you're well on the way to your kidney problems and the rest.
Let's talk a bit more about your week. I know you're going to have some floats and road shows and all of that. Tell us a bit about that.
Well, the first thing is we're launching it on Monday, and His Excellency Alhaji Mahmood, the Vice President, has kindly agreed to launch it.
Right.
What we're doing is bringing to the fore again the digitization we're bringing in here to make it easier for members. We are now linking the NHIS card to the Ghana card.
Yeah.
That will allow people, you can link it yourself on your mobile phone, and then you use your Ghana card to access healthcare.
So people will have access to be able to do this on their own, from their phones?
Yes, on their own, from their phones.
Right.
The back end of linking the biometric data has been done. Now, going forward, new registrations can be done by yourself online for your Ghana card, and then you access service with the Ghana card.
Right.
So as we all transition to using that national ID, it's easier for the ministry to put in health interventions that really meet the needs of the people and capture them. For a developing country, yes, it's okay to say just amble to the hospital. But if we truly want to consider ourselves as part of the developed nations, we have to change that. And it's about staying healthy and not waiting to be sick and going to a hospital for care. And that is the shift that we need to talk about in Ghana and change the landscape.
Talking about some more of your activities, there are a lot of people in the system who may not have renewed their cards and all of that. And I know renewals and registration are an integral part of what you mean to do, especially in densely populated areas. How exactly are you going to roll this out?
So across the country, our districts and regional offices will be out in the communities. They will be helping people renew themselves with their mobile phone. I must say, Ghanaians have embraced it. 75 to 80% of all our renewals now are self-renewals by mobile. But we'll be out in the community with our machines to try and educate people on the benefits of renewing their cards. As I said, we already have 77%. The other 23% we will try to use this week to also get them on board.
Right.
Once we are 80% and above, then we can say we are well on the way to achieving UHC.
What are the other key activities that are going to characterize this week?
The other thing that we will do is, as you know, we're the regulator of the private health insurance industry. That is an industry that needs to grow. We have put in quite a lot of guidelines, protocols. So what we need to do is we have a forum on the Thursday afternoon where we will interact with the public using the providers, the schemes, and clients to show the benefits for those who want private health insurance and take feedback from the audience on how to really grow that industry.
Right. So we'll be wrapping up in a bit on the week proper, but before we do so, you've spoken about there are different components. Now, on the educational component, for example, in some places, even here in Ghana, you would notice that those offering health insurance schemes, in fact, educate their members, those who wrote in, so that the burden on the scheme is not that much. Is that a drive the NHIA means to embark on forcefully moving forward?
Is. We need to really talk about prevention, promotion, healthier lifestyles. It's about staying healthy. By the time you are sick, you have been too far down the road sometimes, and money doesn't then solve the problem. So it really needs a massive education drive in local languages at that level, the layman's term. None of this medical jargon. Let's come down to everyday language and try to get the public more interested in their health. Our offices, our district offices are actually not busy at the moment because so many people are doing self-renewal. So that is the change we are ushering in now, where our district staff will be in the community, doing a lot more engagement with the public.
Right. Now, on that same front, ordinary Ghanaians, yes, we have the NHIA levy where everybody is contributing certain percentages, but what can ordinary Ghanaians do to support the scheme, apart from maybe falling sick? What can we do to support the scheme?
Falling sick doesn't help us. We must remember that the levy is a tax. If we don't all pay our tax, the levy doesn't grow. The design is that as a country and our economy is growing, our GDP is growing, the portion or the amount of money coming from the levy also grows. Yeah. COVID has impacted us, and the levy for us has dropped a bit. But I think it's important for Ghanaians to understand that the levy is the backbone of the health insurance, levy and SNIT. And so we must all try to pay our taxes and stop dodging taxes.
Right.
It's not easy. And then SNIT, people's SNIT contributions must go. That forms the backbone. The premiums and processing fees, now that we're doing mobile money renewal, is going up.
Right.
And the more we all get on board, the more that portion will also increase. That allows us to pay the providers adequate amounts and on time to guarantee good service. But I would like to tell the public that we have an authentication feedback mechanism now.
Right.
If we all want to be what His Excellency the President said, citizens and not spectators, please respond to that SMS message you get on your phone.
Have you been shooting these messages already?
Yeah, everybody who goes to a clinic or a hospital to seek care, to be able to claim money, right, the provider uses an authentication code. Okay. That automatically sends a message to the member, giving the name of the provider and the date, right, and asking you, were you there? Now, if you were, that's all right. You don't have to respond. But if you weren't, just press 2 on your phone. That is enough to trigger an investigation here. Right. And it does reduce possible fraud. Within the year that we've had this up and running, 2 providers have been taken off health insurance because of the public's response. Yeah. And we urge all of you to please be part of this. This scheme is for all of us. We are just the custodians. So it's important we all play our part in keeping it running.
So playing our part, like I was intimating earlier, if you can afford not to fall sick, do the right things. That is a good way to go. And you also added the payment of taxes, and we know how that works. But when you speak about this integration, the NHIA card, and of course the Ghana card, when is it going to take place? How are Ghanaians going to take full advantage of this?
We will continue to, from Monday when the Vice President launches it, we will educate the public. But we all want to transition to one ID card for all major activities in the country. And that is the Ghana card. So eventually, we want to phase out the health insurance card. The Ghana card has more comprehensive details and obviously the biometric identification. So initially, we want people to do linkage. So if you have a Ghana card and an NHIS card, link the two and then begin to transition to using the Ghana card to access care.
Right.
We will then bring up the modalities for those who don't have health insurance but have a Ghana card, on how to register themselves on health insurance and use the Ghana card for care. Going forward, once you do the linkage, your annual renewal should be through the Ghana card.
Right.
Change is difficult, so we will transition and work the two side by side for a while. until we feel the public are very confident, and then we can begin to withdraw our card from the system.
Right. There's been talk in the past from 2009 thereabouts about a one-time premium, and we've seen Obamacare in the West, in the US and all of that. Is that a possibility? Is that something the authority could explore in the future?
No, I think one-time premium is, it's had its day and it's gone.
Right.
It's gone. It wasn't very feasible in that the study suggested the amount of money you needed to pay for the one-time premium would have been beyond the pockets of a lot of people to pay in one go. Currently, about 65% of our members don't pay any premium. It's free. That's what the tax does. 18 and under, you pay 5 cedis if you're at our office, 6 cedis if it's for a whole year. Over 70, it's the same, 5 cedis, 6 cedis. That is not much to pay for a whole year's worth of healthcare. The informal sector, who are in between those ages, it ranges from 22 to about 30 cedis, depending on the area you live in. I don't think that is for a whole year's worth of care. I don't think it's too bad. We will see what will happen in the future as our economy grows. If the tax component becomes bigger, can we reduce that? You know, there's so many options. Nothing is set in stone.
Right.
We cannot, those of us who are here now, cannot claim to have all knowledge. I think it depends on the macroeconomy, the fiscal space, as to where we transition to.
Now, what would be your parting words, especially with a focus on your week-long celebration coming up next week from Monday? What would be your parting words on that?
All those who have the biometric NHIS card, it's the blue one, please get it and wait to hear from us on Monday as to what you do. No matter how long you have defaulted, please find it in your bottom box, as they say, and have it ready on Monday. You hear from us. If you have the old card, which was yellow and blue, that did not capture biometrics. You need to meet up with our teams who are out in the field, at markets, at malls, and transition from that yellow and blue card to the one which captures biometrics.
Okay. Well, I would like to say a very big thank you to you. We've been interacting with the Chief Executive Officer of the National Health Insurance Authority, Dr. Lydia Jani Selby. She's actually given us time to come and speak to her about their week, which is coming up from Monday. And of course, all of us ought to participate. Once more, thank you, madam.
Thank you for coming.
Great.